COVID-19 vaccines already in black markets. Despite the reported severe adverse reactions to COVID-19 vaccines, the demand remains extremely high that the black market is now involved. Experts warn that these drugs may reach the black market near you, and no, it's not flowing traditionally. Several reports claim that COVID-19 vaccines can reach the high and mighty through seemingly valid channels. Miami Herald recently revealed that big donors of hospitals got access to COVID-19 vaccines. 3 South Florida hospital systems in Miami offered these vaccines to some donors in advance. That shouldn't be the case because there's a priority list for the general public. Those who are vulnerable to the coronavirus must get the jabs first. The hospitals defended their decision and they said the donors are in the age group prioritized in Florida. Since no evidence suggests otherwise, the decision is accepted even though it appears wrong. Arthur Kaplan of NYU's Grossman School of Medicine said, "Anything that's seen as life-saving, life-preserving, and that's in short supply creates black markets." Guidelines do exist in the US to properly allocate the limited doses of COVID-19 vaccines. The US CDC noted that the initial supply should be given to healthcare personnel and long-term care facility residents. Overlaps are possible, but the agency places the two said groups as main priorities. So, vaccine doses getting outside the priority list indicates a clear violation of the guidelines. NBC News reported that New York Governor Andrew Cuomo imposed fines of up to $1 million to healthcare workers who violate state and federal vaccine distribution guidelines. The governor even threatened healthcare workers with license revocation if they violated the guidelines. But what is the real danger when black markets are included? The most obvious danger is the exposure of anyone to unknown medications. Black markets are channels used by threat actors to sell illegal or unapproved drugs. Some may not cause health issues and are only meant to rob people of their money. Yet, others may actually release dangerous drugs. If these drugs can harm lives, they can be sold at the highest possible price. COVID-19 vaccines are no different. Authentic doses can be sold at the highest street value, and those who have the money wouldn't care. And for every transaction, the government loses tax, and that impales the economy, especially today.